Greetings. Let us learn about placing endoscopic tattoo. Here is a patient who was found to have a cancer in the transverse colon, and to mark the site, we need to place a tattoo. How do we go about tattooing the colon wall? Here I would like to describe the saline bleb tattoo technique, and for this you need 10 cc syringe of saline, a 10 cc syringe of tattoo, and an injection catheter. So once you've taken the biopsies and you're ready to place a tattoo, this is the sequence of steps we follow. So we flush the injection catheter with saline, and once you see in the lumen that you're able to flush saline through the injection catheter, next with the needle out, next you remove the saline syringe and replace it with the tattoo syringe. And once you have the tattoo syringe attached to the injection catheter, you ask the assistant to slowly inject and stop when the tattoo reaches the thumb of the right hand, holding the injection catheter just above the biopsy port. That means the rest of the injection catheter down the biopsy channel is filled with saline. And with that amount of saline, we create a saline bleb first. And once we have created a saline submucosal bleb, then we fill that with the injection of tattoo to create a saline bleb tattoo technique. So let us see how this is done and what happens at the tissue level. So here is a polyp, and here is the injection catheter with the needle out. You prime that needle by injecting saline, and once you primed it, then you change the syringe from saline to tattoo, inject tattoo till it comes to the biopsy port level. Then we inject and create a saline bleb and then fill it with tattoo. So with this technique, you are assured that the tattoo will be placed into the submucosal space and doesn't spill into the peritoneal cavity. Where do you place the tattoo? There is no need to place a tattoo into the cecum or into the rectum. The only time you place a tattoo into the rectum is if you find a small carcinoid tumor and you're worried that you may not be able to locate it later on. Otherwise, for cancer, you place a tattoo for any lesion in the ascending colon, that is a few folds away from the IC valve, all the way to cancers into the sigmoid colon. There is no need to put a tattoo into the cecum. There is no need to put a tattoo into the rectum, even for benign polyps. On the other hand, you see a benign polyp and you want to refer that patient for endoscopic resection to a tertiary referral center, then there is a technique that needs to be followed. You place the tattoo distal to the polyp, 3 centimeters distal to the polyp, in the same plane as the polyp, using saline bleb technique, and taking a photograph documenting your tattoo and the polyp in one single frame, so that the referring endoscopist can easily find this polyp. On the other hand, if there were to be cancer and you want to refer the patient for surgery, you need to place at least 3 or 4 tattoos so that the surgeon can find the tattoos easily. By placing one tattoo, and if that tattoo ends up on the mesenteric side, the surgeon may not be able to find the tattoo. Hence, for patients with cancer, important to place a tattoo at least 3 or 4 quadrants, again distal to the cancer, and document the location of the tattoo in relation to the cancer. Try to avoid putting a tattoo both proximally and distally, as this can confuse the surgeons. And try to avoid putting a tattoo just proximal to the lesion, because surgeons always look at the tattoo and try to resect a little bit distal. By putting a tattoo distal to the cancer, the surgeon will be able to include the tattoo into the resection, and thereby the cancer will always be included in the resection. What are some of the pitfalls in placing a tattoo? If the tattoo is placed too close to the lesion, especially a benign lesion, it's not good, and we will talk about it. If the tattoo is placed without the submucosal bleb injection, it can go extramurally, and that is also not good. And let's talk about these two issues. If it is too close, it can result in fibrosis, and the subsequent endoscopist may have trouble in resecting that polyp, and that patient may require surgery or some advanced high-risk procedure. On the other hand, if it is placed too deep with extramural injection, sometimes it can lead to peritonitis and perforation, and it can also lead to a lot of fibrosis, and when EMR or ESD is being done, it can put the patients at risk for perforation or even failed resection, thereby ending up in surgery. So in summary, we talked about how to place a tattoo using submucosal bleb tattoo technique, where to place the tattoo, that is distal to the lesion, a single tattoo for a benign polyp, 3 to 4 tattoos for cancer, again distal to the lesion, and avoid tattooing a benign lesion in the cecum or rectum, especially if it is a polyp. One could consider putting a tattoo into the rectum if you are dealing with a carcinoid tumor. I hope this is useful. Thank you.